Have you ever wondered what it's like to get sick in another country? Like, what if you broke your leg in Norway or had a baby in Nigeria? Would you be rushed to a clean, well equipped hospital? Or would you sit in a waiting room for hours, maybe even days? Would you pay nothing or everything you have? Today we are counting down the top 10 countries in the world with the best healthcare systems. And let me tell you, some of these will blow your mind. But first, what actually makes a good health system? It's not just about fancy hospitals. We will be looking at how long people live, how easy it is to see a doctor, how many people pay from their pockets, how many people are covered, and how satisfied people are with healthcare. At number 10 is the Netherlands. Now picture this. You choose your doctor, pick your health insurer, and still get super affordable and high quality healthcare. That's how the Dutch roll. In the Netherlands, health insurance is mandatory. But here is the cool part. The government regulates everything. So it's not a money trap. Everyone gets the same care, whether you are loaded or broke. And they are serious about mental health and community care too. The country runs thousands of small clinics and mental health teams that visit people in their homes. Yes, you get home visits from mental health professionals. Now tell me, what if therapy came to your door like pizza delivery? That's the level we're talking about here. Up next is Switzerland. Yes, the land of chocolates and banks also has one of the most efficient healthcare systems ever. Here is how it works. Everyone must buy private insurance. But if you can't afford it, the government steps in to help. So no one is left behind. And because of all the competition between insurance companies, you get top tier care, fast appointments, fancy facilities, and almost no wait times. Plus, doctors earn well, which keeps the quality sky high. And Swiss hospitals, they look like luxury hotels. I'm not kidding. You might recover faster just from how peaceful the rooms are. Let's pause for a second. Would you pay a bit more every month if it meant faster, better healthcare? Because that's the Swiss model. Now let's fly up to Sweden. Sweden has been doing universal healthcare since forever. It's literally one of the first countries to build a national health system. It's publicly funded and almost everything is covered: hospital visits, maternity care, surgeries. But Sweden also focuses on something bigger. That's preventive care. They just don't treat sickness, they help you stay healthy so nothing goes wrong. Plus, they are big on digital healthcare. You can do video consults, check your prescriptions, or even message your nurse online. Now, think about this. What if you never had to Google weird rash again because your doctor is just one click away? What if your health clinic lived on your phone like Instagram or TikTok? That's Sweden for you. Next stop, Iceland. Now, Iceland may be small, just under 400,000 people, but it's a healthcare powerhouse. They've got a public system that covers everyone. Doctors, they are highly trained. The hospitals are modern, and the wait times are surprisingly low for such a rural setup. But here is the fun part. Because Iceland has such a small population, they've built a tight-knit personalized system. Your doctor probably knows your dog's name, and your grandma's too. Also, they've made mental health a big priority. Counseling, therapy, stress management, all covered. Question time. What if your doctor actually knew you and didn't just rush you out in 5 minutes? That's the kind of care Iceland gives. Now let's land in Norway. This one is wild, in a good way. In Norway, healthcare is mostly free. You might pay something small, like $20 for a doctor's visit. But after you hit a yearly spending cap, everything else is free. Oh, and if you live far from the hospital, the government might pay for your travel. It's built on the idea that health is a right, not a luxury. And it's working. People in Norway live long, have super low child mortality, and barely ever go bankrupt from medical bills. Now, let me ask you, if your government made it easy to see a doctor, would you go more often? Tell us in the comments. Alright, number 5 is China. Now, I know what you might be thinking. China? Seriously? Yes, and here's why. China used to have a pretty chaotic health system, but over the past 20 years, they've gone full throttle on health reform. Today, over 95% of people in China have health insurance. That's almost 1.3 billion people. Crazy, right? They built tons of hospitals, hired more doctors, and even mixed modern medicine with traditional health practices. But it's not perfect. In big cities like Beijing or Shanghai, the care is amazing. But in smaller towns, not always the same story. And yes, if you don't have good insurance, the bills can stack up fast. Answer in the comments. Would you rather have national health care that is still improving or a great hospital that is only in one city? That is the China trade-off. Next up, Taiwan. This place is a healthcare heaven. They've got the national health insurance, and guess what? It covers everyone rich, poor, young, old. Nobody is left out. They even use these smart health cards. You walk into the hospital, swipe your card, and boom, the doctor sees your whole medical history. Super fast, super efficient. Wait times, they don't exist. You can literally walk in and see a doctor in 15 minutes or less. And the cost? So cheap you would think you were dreaming. Now think about this. What if you could get top level care, no stress, no long waits, and still keep your money for jollof rice or bubble tea? That's life in Taiwan. Coming in hot at number 3 is South Korea. K-dramas aren't the only thing they've mastered. South Korea's healthcare system is a beast. Every citizen is covered, and the tech is on another level. You can book a doctor online, get your test results by text, and even use AI-powered scans. Most visits cost under $20, and their life expectancy is over 83 years. They are also so big on prevention. People rarely wait until they are seriously sick before seeing a doctor. Let me ask you, what if your hospital visit was faster than ordering food? Now at number 2 is Japan. You already know that Japan is all about precision. Well, their healthcare system is no exception. They've had universal health insurance since the 60s, and it covers everyone, even foreigners living there. You pay 30% of the cost, and the rest is covered. This includes surgery and cancer treatment. Their hospitals are clean, organized, and insanely efficient. Plus, Japan leads the world in early detection, so diseases get caught early and people live longer. Now ask yourself, what if your healthcare actually helped you avoid getting sick in the first place? That's Japan's game. And finally, drum roll please. Number 1 is Singapore. This tiny country does big things when it comes to healthcare. They've got this genius mix of personal savings, government funding, and private care. It's called the 3M system: MediSafe, MediShield, and MediFund. MediSafe is like a health wallet you're required to save into. MediShield helps with big bills and hospital stays. And MediFund helps those who still can't pay. So no matter who you are covered. Their hospitals are like 5-star hotels, but with world-class doctors and super advanced tech. They also focus heavily on preventive care. Free screenings, regular health campaigns, strict food regulations, all designed to keep people healthy. If you've ever wondered what makes healthcare truly work, these countries have cracked the code.